Do I need L4, L5 disc bulge surgery? How can I avoid bulging disc surgery? Probably one of the most common questions I get asked in the comment sections of my YouTube videos. So in this video, I want to answer that question. And if you're suffering of L4, L5 disc bulge or any symptoms related to disc bulges in your lower back or your lumbar spine, then keep watching this video to the end. So let's start right now.
And if you're new to my channel, be sure to click on that subscribe button and the notification bell so you get notifications on all my new videos that come out weekly, so you know how to relieve pain, conquer stress, supercharge your health naturally, safely, and effectively.
Hi, I'm Dr. Walter Slubra. I'm a corrective care chiropractor in Vaughan, Ontario, Canada. My office is called Back to Health Chiropractic Center, and our objective is to get people back to health with corrective chiropractic methods that work on correcting spinal misalignments and spinal distortions, postural problems that could cause conditions like disc bulges and other debilitating pain conditions related to the spine. So that's what we do. We apply corrective care methods to help correct spinal conditions that have caused lots of debilitating pain for a lot of people. And in this video, I'm not only going to answer the question, do I need L4, L5 disc bulge surgery, or how can I avoid L4, L5 disc bulge surgery? But I'm also going to talk about 3 common mistakes that I think and I believe and I've seen has led people to having to receive surgery. And I also want to address when surgery may actually be required, and of course give some tips on how to actually avoid bulging disc surgery. So let's get right into it. So 3 common mistakes that may cause someone to end up in spinal surgery for a disc bulge. Number 1, waiting too long to get a checkup, a spinal checkup, and waiting too long to get appropriate treatment. I had a patient once that literally, this is no joke, literally crawled in my office because of excruciating back pain and leg pain. Crawled right down that hallway that you saw me walk just a moment ago into the back room. I was able to do a very limited examination, and I told him he needs to go to the hospital, get this checked, get some type of immediate relief type care, and then come back to see if we can do some conservative management. That was on a Thursday afternoon. I called him back on the Monday after the weekend because we're off Friday, Saturday, Sunday. I called back on Monday. He answered the phone and I said, how did the weekend go? What happened? He goes, I ended up in surgery at the hospital over the weekend. So his history was that he's had back pain years ago, and it was on and off, and never really got appropriate care and appropriate treatment and appropriate checkup. And it got to the point where it just exacerbated and got worse and worse and worse to the point that he was actually on all fours, hands and knees, crawling down the hall, ended up in surgery at the hospital. Those are the kind of things that can be avoided. The moment that you have an indication of back pain symptoms or leg pain symptoms at the early onset, that is the best time to actually get things checked and corrected so the appropriate conservative care can be applied and that surgery can be avoided either immediately or in the long run. Had another patient that came in not too long ago. Literally, it was, we're right now in January 2020, filming this video right now, came in October of 2019. So about 2.5, almost 3 months ago. And had immediate onset of back pain and left hip pain and left leg pain right into the foot, numbing, tingling, and had extreme difficulty walking, was challenged with walking because of the leg pain and back pain, and had to be assisted and was limping and favoring the right side to avoid the left leg. And his pain came on instantly that day. It just came out of the blue. He aggravated it by sitting all day a couple of days before, and it aggravated a pre-existing back condition, but he never had these symptoms where he had massive shooting pain down the leg and weakness in the leg and trouble walking. We checked him, we assessed him, and we started his treatment corrective protocol. And within 8 weeks, 90% of his back pain improved, 90% of his leg pain improved. There was some residual symptoms, but he was walking normally again, a lot happier, less pain, more able, functioning, and guess what? Avoided surgery. So that's the 2 types of examples that I see. That someone waited too long and had to end up in surgery, and then someone that got it treated properly and didn't. So as soon as you have symptoms of back pain or leg pain, don't wait to get it checked. Don't think it's going to go away on its own. Symptoms sometimes go away on its own, but the actual underlying condition may be persisting. So it needs to be checked and treated immediately. Number 2 mistake is an improper spinal examination. Now, this is no fault of your own. Okay, the first one you can take accountability because it's your decision to get something checked and treated. But the second one, an improper spinal examination, that's no fault of your own. I've had people come into my office, they've literally exited other clinics and other doctors' offices, and they come into my office because their pain's been chronic over the span of 1 or 2 years or longer, and they've never really resolved their spinal condition. So I started doing my examination, and we do posture check, range of motion, spinal checks. We do leg length analysis and a few other tests, balance tests and thermal scans and x-ray analysis and a whole bunch of things. And the most common thing that they tell me is, I've never had a checkup like this. And I'm thinking, how can you ever get the right corrective protocol if your spine's never been actually checked and examined properly? So that's it. That's mistake number 2. No fault of your own if that's been your case, but what you can do is look for a chiropractor, a corrective care chiropractor that does great spinal checkups, get into their office and get a great spinal examination. That's what you can do if you haven't had that experience. Number 3, the third mistake is that the treatment protocol was backwards or not appropriate for the spinal condition or disc bulge condition. Most of the time, people get a lot of passive therapies like physical modalities, muscle stim or electrical stimulation, TENS machines, hot packs, cold packs, right? But never actually got treatment or care that actually corrected the underlying spinal condition. Or sometimes they're getting functional exercises and functional type of rehab, like mobility and core strengthening. And nothing wrong with those. We get into those too, but they get this first. The functional side of caring and rehabbing the back has been done first before the structural part. We don't do that. We work on structure first. We correct the underlying structure of the spine first, restore spinal structure, and then from there, work on spinal function and rehabilitative type exercises. So that's also no mistake of your own if that's been your case. So you want to find a chiropractor or a therapist or a doctor that works on correcting structure first and then function, because structure dictates function. So that's very important. Now, when is surgery actually needed? So unfortunately, there are times when surgery is needed. Now, if someone's been under my care and we're applying the right techniques and done the right assessments, and they've had literally zero change or zero improvement in their pain from day one over the next 30 days, so 1 month, and I mean like zero. I'm not talking about 10% change or 15% change. Those are good. That's some progress in a short period of time. I like that and I expect that. But if they have 0% change or zero improvement in their spinal condition or pain condition within 1 month, then I would send them out for a surgical consultation or at very minimum more investigation if they haven't had an MRI. But most likely a surgical consultation at that point, that would be warranted. Another indication from a symptom perspective, if there's shooting pain down the back of both legs, from the buttocks or the back down to the foot, that's a sign of a very serious discompression on the cauda equina, possibly, or the nerves exiting both sides, right and left side of the actual spinal area. So that may need a surgical consultation. And of course, any other signs of cauda equina. So things like saddle anesthesia. What that means is numbing effect around the buttocks, around the anus area or the inner thigh area. That's an area where when those nerves are compressed, it's not very common to have a nerve compression for the nerves that go into that area, into that saddle area. So if there's numbing sensation there, if you have loss of feeling in the saddle area of the inner thighs and the buttocks where you're sitting, then that would be an indication of possibly cauda equina, possibly so it needs a surgical consultation and evaluation. And of course, if there is any loss of bladder control, not being able to urinate, you have the want or the need or you want to go urinate, but you cannot eliminate, or loss of bowel control. You want to go to the bathroom, but you cannot go to the bathroom. Number 2, then to release the bowels. That may be an indication of cauda equina, and it requires immediate assessment at the hospital and may require immediate surgery. Now, those are very, very rare, but in some cases they occur, but they're very rare. Most of the time, these don't occur. And if it's caught early enough, if the condition's caught early enough, and the alignment issue of the spine is addressed early enough, then conservative management and conservative care and correction can actually help someone avoid disc bulge surgery or L405 disc bulge surgery. So how can you avoid it? So in many cases, it can be. Most of my patients that come to my office, don't end up in surgery. It's very, very rare unless we talked about some of the things we talked about earlier. So what we do to help someone prevent or avoid surgery, we start with a proper spinal examination. We need to assess their posture, we need to assess their mobility, range of motion, check their neurologic functions, deep tendon reflexes, light touch, and muscle strength, and to see how they're walking, their gait, their balance. We check their structural alignment of the spine by X-ray analysis, often missed. People get MRIs to assess their spine in this conditions, but they oftentimes get an X-ray analysis missed. You need to correlate the X-ray analysis with the posture and, of course, any MRI findings, and based on that entire examination, dictate a course of care. The type of care we do is called corrective chiropractic care. I'm certified in chiropractic biophysics. We apply corrective techniques to improve posture, spinal alignment, and overall well-being of people through the correction of the spine. So based on the X-ray analysis and the posture analysis, we apply postural corrective techniques and spinal corrective techniques such as traction to improve the alignment of the spine and the curves of the spine. In doing so, by improving the structure of the spine, you're now removing the abnormal loads that could lead to disc degeneration and disc bulges just like that. And we're correcting the alignments, improving the abnormal loads, and giving a chance for the actual tissues and the disc bulge to begin to heal properly. And in doing so, when it's beginning to heal properly, the inflammatory insult or the inflammatory response begins to decrease. Less inflammation because of better structural alignment and better function means less pain in the body and in those tissues, less referral or radiating pain down into the leg. That means better ability to function, better ability to move. You're sleeping a lot better. All these things begin to happen. So it is possible. Now, how long does it take? It varies person to person. I've had cases where it's been within 2 to 3 months, people have improved their function anywhere from 80 to 90%. In some cases, it can be 6 to 9 months or even 12 months. It depends how chronic the problem's been, depends how long the person waited to get care. The longer someone waits to get care, the longer the spine degenerates over time, then the more difficult it is to make corrections. So just to summarize, the right corrective protocols for the right assessment at the right time, as early as possible, may help someone avoid disc bulge surgery or L4, L5 disc bulge surgery. So it is possible in many, many cases. All right. Now, this is the kind of work that we do in our office. Like I said, we do corrective chiropractic care. And if you're looking for this kind of work, and you're looking for a chiropractor in your area, let me know. I'll do the best I can to help refer someone in your area. I do have a network of chiropractors that I can refer you to. And if you're in the Vaughan area and you have any questions in the general, in the Greater Toronto area, leave a comment below. I love to answer questions. I do the best I can. I can't answer specifically on what you can or cannot do in the messages, but I can help point you in the right direction. And if you enjoyed this video, let me know. Leave a comment to let me know if you enjoyed it, which part, and like it, share it, and don't forget to subscribe to this channel because I will be releasing more videos like this weekly, so you don't miss out. Be sure you're subscribed if you're brand new and click on the notification bell. This is Dr. Walter. I hope you found value in this, and I'll talk to you soon. To learn more about how corrective chiropractic care at Back to Health Chiropractic Center can help you with your chronic pain problem, visit www.ibthcc.com. Back to Health Chiropractic Center is located at 20 Cranston Park Avenue, number 6, Vaughan, Ontario, L6A2W2.